May is Mental Health Awareness Month. And while progress has been made towards destigmatizing mental health issues, there are still some myths that can get in the way of people actually seeking help and getting the help they need. Joining us now is Sarah Prager with All Health Network, which provides that kind of care to our community as well, behavioral health services around the area. So we have a few questions about this and why people need to seek help.
We can start with the myths. You
Sure.
talked to us about some of them. Let's start with this, that it can take weeks or months, and it's not easy to initiate that first contact, but weeks or months?
Yeah, I'm happy to bust this myth, and it's valid that some people with really complex conditions or in certain rural areas do have a hard time finding care. But for the vast majority of people, especially seeking outpatient care, at All Health Network, we can get you your first assessment in 1 to 2 days. And we've been able to do that for several years. We're very committed to keeping that front door access open all the time for youth, adolescents, adults who need that outpatient level of care. So that's absolutely a myth. You shouldn't, I don't want it to prevent people from calling.
And telehealth has changed things so much. I mean, you don't have to physically go there.
No.
I think it's better in general sometimes, but you never know. It depends on the person.
Yeah.
When you think about this, so many times I guess there's this image that you have to hit rock bottom.
Yeah.
You're unable to get out of bed. You're unable to function before you need help. Not true?
No, I really want people to hear that there is hope regardless of how severe your condition is. So maybe, you just felt not so great about how much you drank over the last week, or maybe you thought you gambled a little bit too much, or your depression is getting a little bit out of control. You're a little bit sad. Don't wait until everything is crashing around. Any time is the right time to call. And we're very happy to walk alongside you at All Health Network at wherever you are in that path to feeling better. Everyone can feel better.
Yeah. I think some of these feelings that you're talking about, whether it would be drinking too much or gambling or depression, those feelings are overwhelming to begin with. And then the thought of how long is it going to take to fix how I'm feeling can be even more overwhelming. But it doesn't have to take months or years. You can start feeling better by just talking about things, right?
Yeah, there's a lot of hope here. Now, for very complex situations, of course, it might take a long time. And we have teams that'll walk alongside you for years if that's what it takes. But for the vast majority of folks, we can get you better in 12 weeks. If you come in motivated, we use measurement-based care and assessments to figure out if we need to pivot with your treatment or when we can celebrate that you reached your goals in as little as 12 to 16 weeks. So it's absolutely possible to do that quickly.
So I want to hit on two things quickly because I know we're running out of time, but some people think group therapy is only for somebody that needs treatment for a sign of abuse in some form. That's not true.
No, groups are great for all mental health issues, and it's just so great to have that community of support.
I think so, 100%. You feel better in anything in life when you're with a group. And then how did this intake begin? How do you get the help? How do you start this process?
Yeah, anyone can call our main number at All Health Network or go to our website, allhealthnetwork.org. And again, we're happy we can get you in and assessed in that first 1 to 2 days and then really help you seek treatment with us or somewhere else. We're happy to get you with one of our partners in the community as well. We just want everyone to know that help is out there, it's accessible, and it's never the wrong time to reach out.
It's so good that over the last 10, 15 years, it's been destigmatized and more people are talking about it and seeking it, but it's never enough.
Yeah, it's true. That's why we have Mental Health Awareness Month.
Exactly.
It has to be consistent and throughout the year. So we're really grateful we can be here to talk about it again.
Yeah, we hope that you get a lot of outreach and people start feeling better. I mean, that's the goal. Take care of your whole health. Feel better.
Mental health, physical health, it's all so important. And there's a way forward for everyone. You deserve to feel better.
Yeah, you deserve it. All right. Thank you, Sarah. That's
Absolutely.
great.
Thanks for having us.